Hello everyone, once again welcome to my Oet channel. Today we will have the introspection regarding the Oet exam note on 24 September 2022. So today just we will have the case note discussion, then at the end we will see the sample letter also. So let us start. As usual, they have given the assumed date. Today's date is 8th January 2022. It is all year 2022 from January 8 onwards until now. The date of exam is same. Actually, before and all, they used to select the date of exam for the later date, but now this is fixed like 8th January 2022. So I want to remind you when you will read the case note, first just read out the first paragraph. I mean, what is the first paragraph they have given in the case note? Then you can move to the writing task, because from there you will have a clear idea about your role. So here they have given you are a nurse in a hospital where you have been treating an elderly female patient who is now ready for discharge. So your role is the charge nurse and you are working in the hospital, because most of the letters are community health nurse. So here anyway you are the hospital nurse. Then we will move to the writing task. Using the information given in the case note, write a letter of discharge to the community nursing team outlining the patient's treatment in hospital and her ongoing care needs. So we are writing the letter to the community nursing team, and we are outlining. That means in your letter you have to outline what are the treatment she had received from the hospital and what is the ongoing care and needs. Address letter to Ms. Ellen Quint, Head of Community Nursing, and Carlington Health Service, 73 Grove Road, Carlington. So this is the writing task. So from here, we can assume that this is a unknown scenario, I mean unknown letter, and the letter is addressing to the community health team. So this is like a nurse to nurse letter. So of course the present medical paragraph is important, and even the last discharge I mean recommendation paragraph also is important in this case. So now we will move to the case note from the starting. So patient name is Beryl Boswell, and bracket I have given Mrs. and date of birth 19 September 1945, and age also given 76 years. So if both date of birth and age is given, better you can select age. Okay, 76 years. Then since it is an unknown case note, so we should have social background. She is a retired hotel receptionist and widow. Then family history, actually they have given mother disease 87 years and father disease 68 with pneumonia and heart attack respectively, but this and all no need for us. Medical history, they have given many medical history. In 2001 fracture right wrist, 2016 hypertension diagnosed, 2010 hearing aids are fitted, 2016 right knee arthritis has started, and June 2021 arthritis in right knee moderate to it became severe, and knee replacement surgery scheduled for this problem. November 2021 delayed the surgery due to leg ulcer. So in this past history, actually we can write the hypertension and regarding the arthritis, because this letter is related to the leg ulcer and this surgery has postponed because of this leg ulcer. So that data we can write. That means from June 2021 patient have moderate to severe arthritis. I mean from 2016 we have to write since 2016 patient has had arthritis and it became worsened and planned for surgery, knee replacement surgery, but because of delayed leg ulcer wound, I mean the leg ulcer management, the surgery has postponed. Then the medication we have to mention: for arthritis she is on paracetamol whenever necessary, and for hypertension she is on amlodipine 5 milligram daily. Then regarding the history, so regarding our letter, the history starts from 29 October 2021. So we know one history that from 2016 patient has arthritis, and in June 2021 it became severe and planned for the surgery. In 29 October 2021, the venous leg ulcer patient has only venous leg ulcer. It confirmed by Doppler studies. So patient has had venous leg ulcer since 29 October 2021, because now we are in 8 January 2022. So this is a somewhat old case. So we can write with the has had at the starting area of present medical paragraph. And this ulcer it is present inside right angle and the diameter is 3.2 centimeter. Treatment with the compression bandage at home. So with the advice of compression bandage at home, patient got discharged. And 3 January 2022, patient complains increased pain in right ankle and the ulcer is not healing well. And in addition, the patient presented with pallor and fatigue, lightheadedness. So they removed the bandage, and when they removed, she presented with the ulcer, and the characteristics are red, swollen, warm, and with high temperature. She presented with a high temperature, and they suspected to have cellulitis, so they sent the patient for emergency referral. And in the hospital, 3 January 2022, she got admitted and cellulitis was confirmed. So they have referred the patient to ward. So they have started some medications. So these medications are important in this case, not. So the medications are, so there was intravenous medications, mainly flucloxacillin 1 gram 4 times per day for 5 days. Ibuprofen 400 milligram, 3 tablets per day. Omeprazole 20 milligram per daily. Per day. And right leg kept elevated by patient is bread. And they have given now the dressing also non-adherent to wound bed and padding to absorb exudate. Then light the bandage, actually they have given the bandaging from light toe to knee, and it should be changed every 2 days. So within 2 days they have changed the dressing also. Then 6 January 2022, they have given that patient has good progress, and the patient's eating and drinking also it became better now. Before it was, the patient was reluctant to eat because of the pain and all these discomforts. Redness, swelling, fever, everything started to decrease, and patient encouraged to mobilize with the working aid. So that is important point. Patient started to mobilize with the working aid, and gradually uh, she can her mobilization became increased with the help of assistive device, and she is ready for discharge today to home. So today, actually, even though she made good progress, she requires some assistive services until her complete recovery. So we are requesting the community nursing team to arrange a community home visits, not a multiple home visits until her complete recovery. So the recommendations are they have given under 8 January 2022, the discharge note, home with the community nursing support to assist with. So the recommendations are reassessment of dressing as cellulitis improves, and patient tolerates return to compression therapy. So that means still patient have problem, but her cellulitis is improving, so she need reassessment of dressing and the compression therapy, the bandaging how to be continued, assessment of pressure ulcer risk, and order appropriate equipment needed like cushion. So that one also can write, and we have to write with the off note or please note or kindly note in the end of the present medical paragraph. You can write the discharge medication is oral, because before it was injection, now they changed to oral flucloxacillin 500 milligram 4 tablets per day for 7 days. And the plan is write the letter to community nursing team. So that is what we are writing. So this is the content of the case note. So here it is easy question, there is not history, nothing, because if you see the many of the questions during 2022, in 2022 you can see that there were more twisting, like hospitalization, then home visit, then we are writing the letter to the GP or any other specialist like that. So you will have confusion from where we have to start, from hospitalization or from home visit, or today's home visit we have to write first, or whether we have to go to the the old data first, like that. But in this letter it is much easier than the before the previous case. No, that means it is straight letter. That means it's nothing but discharge letter only. From the hospital we are just referring the patient to community health team. It's like a home visit request only. And another one more thing I want to tell you, that in some case note you can see that request home visit, But in some case not, they will not mention that it is a home visit, but you have to assume whether it is a home visit request or you are admitting the patient in somewhere like a nursing home or somewhere. But community health center means it will not be the admission. So keep it in your mind. If you are referring the patient to community health center like a nurse or doctor, means it is not admission, because in community health center there will not be admission. It is same like our primary health center. That means you are requesting home care only. So maybe the letter will be for GP, even though he has to know everything and he will arrange the community health nurse service. And here it is direct to community health nurse team. So how we will make in introduction, you will not get more confusion. In present medical paragraph, just you can start with the patient's name and has had venous leg ulcer from 29 October 2021, and gradually you can write what are the presentations she had and why got admitted and what are the management they have given, and gradually how the mobilization has improved, and in today what is the current situation. Then at the end you have to give one small conclusion that however she requires a continued care until her complete recovery. So most of the students may get confusion why ma'am is telling the recommendation sentence here in this conclusion. Actually, this is not recommendation, it is a conclusion of present medical paragraph. This is actually we can exclude. It's like optional. If you want you can write, or if you don't want, no need to write. If the letter rate is big, the words counts are above 200, means no need to write. And in non case also we can exclude this conclusion. But if you're writing in this way, I feel it is easy for the reader to have a sum up. What is because from the present medical paragraph, from the starting itself, we are telling a story, and story should have an ending. So just if you give the conclusion, it will be easy for the reader to understand easily. That means, example, if you have friends, those who are preparing for exam, OET exam, just you can write one letter and give to that friend without case note. If she or he can understand completely about your letter, what is the status of your patient, and what she requires or what she needs from you, like a reader, means you will get B score. If your friend can understand completely what you are meaning, means of course you will your letter will score B score. But if it is incomplete, or she's the reader is not sure about what your meaning means, it will go to C or C plus. So this is a easier technique. That's why I'm telling, if you're writing like a story, means it is easier for the reader to understand what you mean, or what is your requirement for the patient. Of course, in the recommendation paragraph you are going to write the requirements, the recommendations, but there it should be elaborate way. Here I'm just telling about the conclusion, just within a sentence, like therefore, or thus, or this is the reason for her referral, something like that. It's a simple sentence. And as I told you, if the letter is big, no need to write this one. But if the letter is somewhat in medium size, means it's okay, fine, you can write the conclusion of present medical paragraph in this area. That means in the last part of present medical paragraph. Okay. So I hope this case note is clear for you. So this is the way you have to read the case note. So by reading itself, you have to make a story. So now it's I think it's clear for you. We will just start from the hospitalization and the presentation. What is the confirmation, how you confirmed, and what is the management you have given, and now what is the status of the patient. So that is only, it will come in the present medical paragraph. And social paragraph, it is easy for you. Recommendation paragraph also it is given. So just you have to write it in with the format. So this letter actually it is easy. So like this only you have to read and fix the case note. You have to read and fix it in your mind and make a story. Just you can write it in a rough paper, like only the short notes. Then again when you will come to the letter part, it will be easy for you. So we will see the sample letter. So we will see the sample letter. So we will start with the date, 8 January 2022, and with the address, Miss Eileen Quint, Head of Community Nursing, Carlington Health Service, 73 Grove Road, Carlington. So this is the address, and we will go to the salutation. Dear Miss Queen, regarding Mrs. Beryl Boswell, aged 76. So as I told you, instead of date of birth, always it's better to write the age. It is easy for the reader to understand the age. Then we will go to the introduction paragraph. So as everybody knows, introduction paragraph should contain mainly two things. The first one should be the patient's recent present condition. Second one should be the requirement. So here the condition is recovering from cellulitis, and the requirement is like ongoing care or continuing care. And you can write with the assessment and management, ongoing assessment and management, or continued care with the assessment and management, or continued assessment and management, whatever. So nothing but it should be like a ongoing care or continued care. So we will write in this way. I am writing to request home visits for, because it is a home visit, pure home visits for Miss Boswell, who is recovering from cellulitis in right angle. So you can just mention the area also. She requires continued assessment and management following her discharge today. So you can modulate the way of presentation. It's like I am writing to request, or I am writing to introduce, or whatever. As you wish, you can just start the sentences. And then we will go to the present medical paragraph. So during the case note explanation, what I told you, we can just start with the arthritis, because this arthritis is closely related to this condition, because the surgery has postponed because of the leg ulcer, and now it became cellulitis as a secondary complication. So we will just start like this. Mrs. Boswell has had, always remember, if you want to write something like old history with the date or with the time period, please mention with the has had, or else you can just write with the has. So Mrs. Boswell has had right knee arthritis since 2016 and was scheduled for knee replacement surgery for November 2021. So this is a starting. We will just write regarding the arthritis. We just started with arthritis and planned for surgery. Then we can write, however, the replacement surgery, however, the procedure, you can just write the procedure or the operation got delayed due to her venous leg ulcer, which was confirmed by Doppler studies in 29 October 2021. So just we wrote, however, the procedure got delayed due to her venous leg ulcer, which was confirmed by Doppler studies in 29 October 2021. The date is important because the patient is scheduled for surgery in November 2021. But this venous leg ulcer is diagnosed on, was diagnosed on October 2021. So that's why it got delayed. And yeah, then now we will go to the hospitalization. Now we can write, for which she was treated with the compression bandaging at home. So at that time there was no admission, just they have explained or like advised for compression bandaging at home. Then we can write, subsequently she presented with the definitive symptoms of her diagnosis and was admitted to the ward on 3 January 2022. Here actually no need to write all signs and symptoms during the admission, because for now actually we wrote all old stories. It's already it's got diagnosed with the Doppler studies, this and all. It's clear that already patient got admitted with venous leg ulcer and cellulitis also got confirmed. So no need for irrelevant data. And another one more thing, we are writing to the nurse, head of community health nurses. So no need to write like elaborately what all the signs and symptoms during admission. We can just write, subsequently she presented with the definitive symptoms of her diagnosis. Definitive symptom is already the condition got confirmed. If it is suspected cases, we can write suggestive symptoms. Okay, suggestive symptoms and definitive symptoms. Just now mark that wordings. Then, and was admitted to the ward on 3 January 2022. So this much you can write it in one paragraph, and in next paragraph we can write the remaining thing during hospitalization. Okay, I can write, during hospitalization, Mrs. Boswell has been managed with the injection flucloxacin, 1 gram, 4 times daily. So there is one rule for the medications. We have to keep comma in after the name, the dosage, frequency, everything. And if there are more than 3 medications, you can just put a semicolon after the first medication. Then you can write the second medication list. Then you can write and. Okay, so that is the one. And in description I have given many links for my YouTube videos. It's related to relevant data regarding OET writing. So if you have any doubts, you can refer that one also regarding the medication, how to write and passive voice, and however, even though the use of however, and even though, and many things I have given, even the OET updates also. So you can just refer there. Then we can write along with, so first we started with injection flucloxacillin, then we can write along with ibuprofen and omeprazole, the dosage and no need, because now we are not continuing with these things, now we are continuing with the antibiotic only. And her ulcer has been treated with non-adherent dressing with the padding to absorb exudate and toe to knee bandaging. So this everything we can write it in one sentence. Her ulcer has been. Why we are writing has been means because still patient is on dressing. If it is finished, we can write she was managed or she was treated, but still patient is on dressing and we need to continue, and this is one of the recommendation, means we have to just write has been. Okay, so we can write has, her ulcer has been treated with non-adherent dressing with the padding to absorb exudate and toe to knee bandaging. Then which needs to be changed every 2 days. So there's already they have given, so we can just write it here, so no need to repeat it in the recommendation paragraph, which needs to be changed every 2 days, and before which there is no comma, only before for which there is comma. Then gradually, comma, her mobilization was assisted with walking aid, and today, comma, she is ready for discharge. So that's a simple way we can just sum the hospitalization. That means gradually her mobilization was assisted with the walking aid, and today she is ready for discharge. Discharge with, so here another one more thing we can add regarding discharge medication. Either you can write here or you can write it in the end of present medical paragraph with the please note or off note or kindly note, like that. So it is easy here, we can just write like in the continuation, assisted with the walking aid, and today she is ready for discharge with oral flucloxacillin, 500 milligram, for tablets for 7 days. So because that injection has been changed to oral, that's why we have to just write oral. And some students, they used to write tab instead of tablet. You can write either tablet or oral, but don't write tab dot. Okay, then we can just sum up. That is a conclusion what I told you before. Therefore, an ongoing care from your facility is essential until her complete recovery. So this is optional. If you can write, you can write. If the word count is less than 200, means you can write, no problem. Then we will go to the social paragraph. Mrs. Boswell is a widow and retired hotel receptionist. So here you have some confusion whether we have to write personal history first or you have to write the medical history first. Always to start with the personal history. That's my suggestion. And in that marital status, you can just mention starting itself. Okay, so Mrs. Boswell is a widow and retired hotel receptionist, and here you have to just mention about hypertension, because arthritis is already we have mentioned. So she has had hypertension since 2006 and on amlodipine, 5 milligram, daily. Then she is on paracetamol for her arthritis as required. That one, just only the medication we can mention here, because in the introduction, actually in the present medical paragraph, we didn't write about paracetamol. So here you can mention that one also. So I hope it's clear. Then we will go to the recommendation paragraph. You can start with it would be appreciated if you could, or you can start with kindly, or you can start with from above information. So it's up to you. So just I started with kindly reassess Miss Boswell's apostrophe S Boswell's dressing. As her condition improves and tolerates to compression therapy, please monitor her risk for pressure ulcer and order cushions if required. So this pressure ulcer and cushion, it is related things, so you can just add together and make a sentence, make a single sentence. And regarding the dressing, you can just write separately. Then same as commonly we will write, if you have any queries, please do not hesitate to contact me. And here they have given the reader name, so yours sincerely. You can write registered nurse, or you can just write the designation what's given in the case note, like charge nurse or head nurse or whatever it's given. And in the recommendation paragraph, there will be one confusion, or most of the time students used to forget to write patient's name. So remember, each and every paragraph, the starting should be patient's name, the surname. Kindly reassess Miss Boswell's dressing. Don't write kindly reassess her dressing. it should be with the patient's name only. And after writing everything, just go through once again, that is proofreading. If you don't know what is proofreading, how to do, just see the description, I have given the link. And why it's important means because in most of the students later I can see that the gender changes. Instead of her, he, instead of he, they will write she. So this her, him, this everything, it is quite natural, we will miss because more things are preoccupied in our mind when we are writing the letter. Maybe you are reading topics, or maybe you are listening topics, or your previous writing topics, everything. So you will mix up with every ideas. So when if you are doing the proofreading, after each sentence, after each paragraph, just go through the go through the writing what you wrote in the letter. And after completion of your letter, just go through, that means just a quick read. That is a proofreading. At that time you can come to know that what are the mistakes you have done. Sometimes you will write to has, to had, instead of has had, maybe it only has. And sometimes instead of was, there is is, or instead of has been, you have written was, something like that. And sometimes you may miss passive voice, or you may write their active voice. So these all simple things you can correct by using the proofreading. And of course, mostly you will not get a time for proofreading if you didn't use the time wisely. So just read correctly your case note, how I read for you. And in the same way, and underline, you can just underline, but no need to write anything. Don't write anything in your case note, just underline, no problem. Then just make a story and start writing early without any delay. If you have any problem in the introduction, just leave it there. Write all your later. At the end, you can just see the present medical paragraph, what is the content, just concise and write it in the present medical in the introduction. Okay, so introduction means that recent present medical condition. Sometimes you will get confusion, so just you see the present medical paragraph, what you have elaborated there. The concise form is the one recent medical condition. So like that also you can just save the time. Don't be panic, just relax and write your letter. And your presentation also, the handwriting and the letter size, this everything also you have to keep it in your mind. It's not a big factor, but even though you can just keep it in your mind to present neatly. So I hope this lecture is clear for you. Just start writing in this way. I hope which will be helpful for you to get B score. And we will see with another one informative video. Until then, bye. Take care.